starts as an acute insult. Chinwe has alluded to most. It starts as an acute, and if you keep exposing yourself to that damage, it then progresses to chronic. And when you're talking about chronic, Chinwe had earlier explained the liver architecture, talked about the cells, talked about the ducts, talked about the blood vessels.
Yeah.
So when you've had that continual exposure for quite a while, that the cells are damaged, the blood vessels begin to be fibrous. So rather than having a smooth tube that is just running, then you have, should I use the word scar formation?
Okay.
So it becomes a bit more rigid. It's not as flexible as it should be. It becomes more rigid. Therefore, the liver that acts as a drainage cannot filter, rather should be the right word, cannot filter, because it acts as a filter. So it sieves in what the body needs and out what the body doesn't need. And most of it gets discharged into the bowels, and then you excrete it in your poo, and that's your poo that is yellowish colored. And that's how it works. But when the damage gone on for some time and the liver cannot perform its function, and then it's beginning to fail, then there's a chronicity to it. It becomes chronic. And whatever causes acute leads to chronic. It's just that it's gone on for a longer time. And that's what it is.
And when it is chronic, it's only managed, you manage it. That's patient, it cannot be cured.
Just managing it and slowing further progression. Because the insult has gone to the point it can't, it's irreparable. You just have then got to try and slow it down.
Oh, but when I'm listening to all this information, all the messages, oh my God, information is power. I'm learning a lot with this show. Thank you so much. Then we have cirrhosis, right?
Cirrhosis.
And it's one of liver disease. Can you explain this one? I think do we need to explain it in a
simple terms? It's scarring, isn't it?
It's scarring
of the liver. So it means that the liver architecture, those nice cells with the tubes running in between, it's been scarred. Similar, if you cut your skin, it heals with a scar. So that's what you get within the liver. So that cell has been damaged, so it's healed by scarring, and therefore that part isn't going to work. So that's what cirrhosis means, and the cause will be different things. And so if you're left with a little bit of scarring, then other parts will compensate, and the liver will carry on functioning. But then if the scarred bit is more than the healthy bit, then of course that's where the problem starts. That's where you're then into liver failure.
Wow. Can it be treated?
Managed.
But liver problem, is it the same like kidney? Do they have, when we have kidney failure and that person or the patient goes under dialysis, what of liver? When liver fails?
So with liver, it's a little bit more of a problem. You don't have that dialysis for an external pump to take care and filter the blood. We don't have that for the liver. So all you can then do is to remove further damage so that the little cells that you're left will be preserved to keep working. Or then you can then start talking about liver transplant when it gets to the point where you have majority of the liver cells has been, because you've got to find a way to take over that filtering role. So you then have got to go down the route of liver transplant. And then without that, unfortunately, it's death. If it's gotten to the point where you're needing transplant, if you don't have a donor, unfortunately, then it's a matter of time until the person dies. So unlike the kidneys, there is no replacement.
Wow. And there is something I read about portal hypertension regarding to. So when I read it, I was like asking, so does liver have hypertension?
Yes. we're talking about, remember when we talked about hypertension generally? So that pressure is throughout your vascular system, your veins and your arteries. Then portal hypertension means it's limited within the veins of the liver. Yeah, you know, we said the liver, you have the cells, you have the tubes, and then you have the blood vessels and the bile duct, the gallbladder. So if that hypertension is limited within the blood vessels of the liver, that's, and the biliary system, the gallbladder, that's where you get your portal hypertension. And ultimately that will lead to a burst somewhere and bleeding, and acute bleeding if it's not managed.
The person might lead to death. Like Dr. Osuna say always, anything can lead to death.
Very true.
Too much can lead to death if you keep breathing.
Too much of anything is not good. If there's nothing else out of this, things should be done in moderation. Okay. And it's ignoring that, and to your cost, actually, it gets worse by the day. There are some conditions that are reversible. Okay? There are some conditions that are reversible, and it's all down to you. In particular, the lifestyle. If you're having conditions linked to lifestyle, of which diabetes is one, because diabetes will give you fatty liver, and you get the NSLD and you ignore it, it progresses to fibrosis of the ducts. And then you end up with cirrhosis, and it's a point of no return. Losing weight, doing what is right for you, managing the diabetes, for instance, well, does help. The portal hypertension Chema described is like an end-stage thing as well, because you have the veins supplying the cells will drain out, you get into your ducts, and it goes that way. But if the cells are damaged, so there's backflow, it cannot go in there. And don't forget, within the liver is where you produce your blood clotting factors. So if the blood clotting factors are not being produced, alongside the 1,001 other things the liver does, so if the blood clotting factors are not being produced, you're at high risk of bleeding. And when you bleed, there's nothing to stop you. You will literally bleed to death. So the key thing...
when you say about bleeding, do we intend internal bleeding, or the bleeding will be...
It can be anywhere.
Any bleeding.
Right? Because the factors that help the blood form clot, they're not being made. So it's like you've turned on the tap. There's nothing to stop that tap. And you just literally... And chronic liver disease, alongside you not having the coagulation factors. In chronic liver disease, the drainage is not there. The blood vessels that feed into the liver itself gets blown up. There are some vessels coming from the liver going to your food pipe. They all get blown up, and gosh, if you have an elastic, it will just keep extending and extending and extending, and there comes a point, the person that's bleeding that you can't control.
Oh my God.
And it's usually massive bleeding, isn't it? Because those
Significantly,
blood
because
vessels are
they're high
hot.
tension vessels as well. They're big vessels, and once they pop, and you'll see it coming, because yes, what's happening within the liver you don't see. But when it's progressing and getting that bad, you begin to see vessels visible in the abdomen. Quite visible under your abdomen. Yes, the one that happens on the liver and happens on the food gut, you don't see. But when you're having classically called caput medusa on your abdomen, you're just a sitting time bomb. Waiting for it
distributing the blood.
How do you feel it?
You see it, not just feeling it.
No, your doctor will be able to see it and see
Even
this
you
is
might
really,
just see some prominent things on your abdomen.
You will see lines, not your stretch marks. Let's not confuse things. Not your stretch marks, but this would be similar to varicose veins. Varicose veins. You know what I mean by varicose veins on the legs. Then you get same on your stomach, on the surface. That's a sign of really very bad liver disease and portal hypertension And then, of course, the end stage, if it pops, the person is just
You
vomiting
vomit and
blood.
vomit blood.
Just vomiting blood until the blood runs out and you die, unfortunately. So
It's like
terrible
I've
way
heard,
to die.
yeah, it's like I've heard this story before that somebody was
Vomiting blood. Yeah, it must be from a ruptured
It's not the only cause
or
of
just
vomiting blood.
ulcer or ruptured
It's not
ulcer.
the only cause of vomiting blood. There are others,
That's-
but it's one of the presentations you can have in the
Wow,
clinic.
there are a lot of things we really need to know.
Yeah.
Wow, information is power. Good. And again, we know of hepatitis. Hepatitis is a very common disease, especially even here and in Africa. So can we regard it as a liver disease, right? Or
Inflammation of the liver.
inflammation? of the
Hepatitis,
liver?
that word, that's what it means,
Depends.
inflammation of the liver.
Mm.
But then it depends on, it can be caused by
I mean,
several things.
wow. So we have hepatitis.
And you
A.
have acute and chronic.
Okay, we have hepatitis acute and
Acute hepatitis.
It
Okay.
starts as acute
Acute.
Yeah.
and progresses.
And then
Wow.
becomes chronic.
mm,
And then you then have different causes of it.
wow. So we have hepatitis A, B, C.
Okay. These
D.
are just viruses.
Mm.
So hepatitis virus, so that's
All right.
Yes.
Have you seen information is power? Then we call it.
All right. Okay.
Information is power. I didn't know about this before. We call it hepatitis A, B, C.
okay.
It's a specific time.
It's a specific.
it's a term, yeah.
Okay. Now I got it. Good. Don't worry, I will soon become a medical doctor.
Yeah.
So
What we mean by that, the word hepatitis means just inflammation of the liver.
Okay.
And then the hepatitis A, B, there's hepatitis virus, there's hepatitis
Okay.
A, B, and C,
C.
D. Yeah.
All right.
So these are viruses that can cause problem within the liver as well as other parts of the body.
Wow.
Yeah.
I've not heard about D, E, and G. They are not too
Some
common.
of them are not that common, not that severe. They cause mild illness, which you just maybe you have a bit of vomiting and diarrhea maybe, and then you recover. So it doesn't really cause much problem. I think the A mainly is with contaminated food,
It's food poisoning.
food poisoning, yeah. Yeah. And then you have your hepatitis B, which is a little bit more serious because it's bloodborne, contaminated blood products, and hepatitis C, that one is mainly sexually transmitted. I think those are the main three. The others, not really. It usually causes minor illness and one recovers with no problem.
Wow. Because there was some time I called a friend and she told me that she was sick, but doctor said that she had hepatitis. I was like wondering.
Just
What
inflammation of the liver.
Wow. I was like, because when she mentioned hepatitis, I was, yeah. Wow. Can you tell us more about the hepatitis B and C? Because those ones, I think many people do not know. Those in Africa, especially Nigeria, I've spoken to some people, they don't know about B, C. But, yeah.
So
They can be regarded as chronic, right?
acute and chronic. So one would first have an acute infection, and then if you're able to clear it fully, and then you may then be left with a latent, where you become a carrier of the
Okay.
hepatitis B virus. Yeah, if you don't clear it. So some people will clear it fully
Yeah.
and be free of it. But some people unfortunately may not be able to clear it fully. And how do you pick it up? It's usually contaminated blood product by having some sort of health and procedure, maybe visiting a dentist, sharing needle, for example. Simple as piercing your ears, because people do it at home. You do mine and I do yours, and you might contract it that way. And some people will be lucky enough to clear it fully and shed the virus and it leaves their system.
Wow.
But some people may not shed it fully. That's when you don't become a chronic hepatitis B carrier.
Yeah.
And you can then, that in the future, that can lead to liver cancer, can lead to liver failure. It can also then be passed on, say if a lady is a carrier, she can then pass that on to her child during childbirth. But then we do have vaccinations
for B.
for hepatitis B.
So
And I think we have vaccinations for C.
It's more the B.
The B, yeah?
The thing with the B, but this is just with the microbiologist and typing it in the word, is that hepatitis B is just hepatitis B. But for you to know your infection status, there are some antigens and antibodies, and I'll link it to the COVID vaccination.
Yeah.
Because what happens is that, like in the COVID, you introduce an antigen into somebody. The body then builds up its own immunity, and that immunity comes in the form of antibodies, and that is what gives you the protection.
Okay.
So with hepatitis B, okay, with typing for the lab people, they've typed it as having the DNA and whatever that goes with the B hepatitis virus. The next thing you need to know is, what is this person's infective state? Because having just hepatitis B is hepatitis B, it doesn't tell you a lot. But what then is significant and comes into play for pregnant women or the children of somebody that just delivered is, what else is attached to that hepatitis B?
Yeah.
Okay, if you're having somebody with surface antigen, it's telling you that that person is infectious. But if you're having the surface antibody, you've been through that process and you have a bit of protection. So the antigen, should I use the word as a stimulant? Whereas the antibody defense gives you some protection. So anybody having B surface antigen positive is quite infectious. And there's a degree of protection with the D, with the antibody. The same applies to, I would like to believe that IV drug use is not that common in our place, then I hope. But the hepatitis C is a lot more common with IV drug use, shared needles and that kind of lifestyle.
Yeah.
Okay. And yes, that one gets more transmitted through its lifestyle to a large extent and body fluids in one way or the other. And that actually has a chronicity attached to it. There are immunotherapies you can do if figured out early to help and stop and reduce the infection rate that can be transmitted to the newborn child. But you need to type to know what is that person's status exactly. Antigen, not too good if you're positive. Antibody, you've already mounted your own response.
Yeah.
Okay, but your child needs to be protected once you have a baby. And the C, the child also needs to be protected. And the whole protection depends on, if you're having a C person deliver, yeah, the vaccines are there, which you can give in 1 month and 2. Then you go into the schedule of 2, 3, 4, and then you give your, you do 1 month, 2 months, then you go into the program, 3, 4, 2, 3, 4 program, and then they top up at 12 months. But for somebody who is surface antigen positive or with the C antigen, you have to protect that child instantly because the child has no protection. And you tend to use immunoglobulins for that one. Give them a boost and still continue with the vaccine. So you really need to type when you're talking about hepatitis B, because that's the real McCoy, it's the B and C. The A settles itself, and you vomit and have a bit of fever, you're tired and such like, with the diarrhea that goes with it, it settles. But it's the B's and the C's that the D's and whatever else is not as severe as you have the B and C.
Even I have a question here which is very, very sensitive. So when someone is a newly married couple, and one of the either husband has hepatitis C, the C type. So how would they do in terms of having children?
Well, it's not genetics, isn't it? No.
It will stop you from having children. It's infection that your child might get.
So,
It will stop you from procreating at all. It will not have your children. But that child has to be protected.
even the wife?
There's a degree of protection as well. And perhaps I don't know, whoever party it is, should consider having some treatment to see if they can. Because alongside knowing that you're C, you need to know the viral load as well.
Okay.
Because the viral load tells you how infectious you are. And if you're having a high viral load, then you need to be treated. And you can get rid of it with proper treatment. Especially disease, you can't. It's not
similar to HIV. Yeah.
It's not born. You need to be treated, and you can't get rid of it. And then you live your life forever as happy as you can.
Wow.
So I don't think it should impact on anybody's
No, it's
marriage.
not like
It's treatable, and you can have children. It will not impact on fertility.
Okay.
But if you're still, especially the mothers, a father having it, he may transmit it to the mother. But the key thing is mother, because the mother can then pass it on to the child.
This is really...
So yeah, I mean
It's
the
treatable.
way to look at it, it's not like we're talking about sickle cell where you have your A and AS, and
Absolutely.
it's not like that where your child will inherit it. No, the risk is what Dr. Ursula have just explained. Say if the woman is the carrier, then she can equally infect the husband. It's infection, and then also infect the child. So that comes more into sexual health.
And the
you
woman
have a
can
partner,
infect the woman.
and then the woman in turn infects the baby. So you look at it in terms of sexual health, how to protect yourself from contracting these illnesses like HIV, chlamydia, gonorrhea, that sort. It's the same sort of class, but then unlike the gonorrhea, well, gonorrhea can lead to infertility. HIV, of course, if not managed, can lead to death. Yeah, so then the hepatitis, can lead to problems. And also, you spreading and infecting other people. That's the way I think. Does that answer your question?
Yeah, it definitely. And HIV now, how do we link it to liver?
Again, it's the viral load that we're talking about. So it's if that person has lots and lots of, so the virus have taken over the person's system, and all your body is chucking out is HIV, more HIV virus, rather than producing what your body needs. New skin cells, new antibodies. Rather than doing that, the HIV has overtaken your system, and all your system is producing is HIV. So that will overwhelm your organs, and then you will become anemic and malnourished, and you die. So it's something.
Put it this way: the liver is a filter. Okay, and most things we eat, and even the sun, some bit of the sun gets metabolized in the liver to give us vitamin D. Then it gets its second processing in the liver. So it's a filter. Things we absorb from the gut as well gets metabolized in the liver. So whatever food, lifestyle, another thing, it's more common in the West actually, because they have all sorts of parasites that can reside in the liver. Yep. So partially cooked or literally uncooked meat, uncooked fish, the hookworms of this world we talk about, the worms of this world. So anything can affect the liver. It's just walking through it, identifying the cause and treating that primary cause in good time to stop progression. Anything can affect the liver.
Yeah. Wow.
The sanitation comes in. Yeah, you drink contaminated water, and of course, where would the the organisms enter your blood system. Majority of that blood is, getting filtered through the liver. Those things get trapped within the liver. Then lo and behold, you have your liver abscess because you have that pocket of infection in the liver that your immune system is trying to manage. But because those organisms are that active and infectious, then you have pain, you have fever, and you touch there and it's ouch, ouch. Then you need antibiotics. So that's different. You need to drain that pocket of pus. And,
Wow.
Another thing worthy of mention is that we take a lot of herbs.
Wow.
We don't know what it contains. We don't know the toxicity. And like I said, the liver is a filter.
Yeah.
So if it is continually filtering toxic substances, there's a degree of damage that goes with it. For alcoholics, you can figure out from a blood test if this person overindulges in alcohol. And this is for the professionals. Your gamma GT gives you an idea that this person is overindulging alongside the pot belly. And once you're having the pot belly, you're having fatty deposits in the liver cells. And when you're having those fatty deposits, rather than having a tube that is patent and there's exchange across the membranes, you're having layers of fat blocking that exchange. And if you do a scan, all you see is just fatty. So with those fatty deposits, they now over time destroy the thin muscular membranes of those ducts. And that is your cirrhosis.
Wow. Scary.
That's your cirrhosis. And it progresses. Because by the time you're getting to all this fibrous formation, scar formation, whatever, it progresses. And your exchange, the filtering mechanism is impaired. And when that filtering mechanism is impaired, you have accumulation of products that are filtered. And those products will begin to present. You become anemic. You're always having low blood count. You begin to bleed excessively because the clotting factors are not being produced. The ducts are impacted. You begin to have yellow eyes.
Jaundice, right?
Glucose is produced and deposited in the liver. And if that cannot be deposited, you find that you get into a catabolic state. So you're beginning to burn off your muscles, your fat, the weight loss, and then the tiredness, the yellow eyes. The yellow eyes tends to seep in a bit later, and that is the one people will notice. But it's a journey that you've literally not been aware of that journey until there's a bit of a pudgy, and then you're as thin can go with yellow eyes. That's the one people see more than anything.